You are welcome to a north of England which is still cold and damp. I don't think I'll bother telling you that again because it's basically going to be like this till next March or April now. Now, some updates from the United States today on hospitalizations. Some interesting things happening there. Some stuff from the UK. Russia comes to mind. Bahrain comes to mind. We'll see how we go for time. I'm going to start off with Cyprus though, because an interesting development here from Cyprus. Basically, what they've said in Cyprus, and we're talking about Greek Cyprus here, the southern part of the Cypriot island. What they've said is from March 2021, basically you're going to need evidence of vaccination to go to Cyprus. Or you can still go, but you'd have to do the quarantine, or you'd have to have evidence of a recent test. And this is the way that things are going to be. This is an inevitable consequence, I think, of having part of the world vaccinated and part of the world not vaccinated in 2021. So Cyprus has started the ball rolling from this, but it really will be one of very many, there's no question about that. So basically from March 2021 they're waiving COVID test requirements for vaccinated visitors and they won't have to do quarantine. In other words, they can just waltz straight in as if everything's normal if they have some vaccination evidence. So people are going to want vaccination evidence. Is there going to be a paper certificate? Tend to doubt it. It could be. More likely to be one of these flicky-appy things on phones that they have these days. So that's probably going to extend to, I think, every country in the world really is going to have evidence of vaccination throughout 2021. I can't really see this unfolding any other way. I know a lot of people won't like it, but that's the way I think it's going to be. Travellers will not need to meet other COVID entry rules as long as they have this vaccination evidence. And British travellers returning there to the UK are required to self-isolate at the moment. So what we see is here we don't have a reciprocity. So if you've been to Cyprus and you come back, you have to self-isolate. But if you go to Cyprus and you have evidence of vaccination, you don't. You can just waltz straight in. So, as I say, just a matter of time till this is rolled out to airlines, modes of transport, countries, states within the United States. I think it's quite inevitable. Now, just before we go on to look at the United States, just a quick picture here from Ron. Ron and his beloved wife had Thanksgiving, just the two of them. So I thought that was quite a poignant Thanksgiving picture there, that of course most people in the United States are behaving exceptionally well. It's just a pity that there's a few are causing problems, as indeed is the case everywhere, as we're going to see another example today from Germany. Anyway, moving on to the United States now. United States hospitalizations admissions. Now this is from Medscape. And what basically Medscape have done here is they've put together quite a few tweets and sort of a storyline from various doctors and specialists and nurses around the country. And some very interesting material has come out, and I'm going to share that with you now. You know, to give you the bottom line on this section, what it really means is it seems to be getting harder to get into a hospital in the United States with COVID-19 symptoms. The bar seems to be being raised. So as hospital places become, there's still places in hospitals, but it's getting more difficult to staff them. I think that's probably the main thing. Then the hospitals can't cope with as many people coming in at the same time. So there's got to be kind of some way of, what word might we look for? Rationing might be a word we'll look for. Maybe it's not as bad as that, we'll see. Let's just look at it. Some patients who may benefit from inpatient care are being sent home, is the sort of contention of this this article, and it is borne out by evidence, as we'll see. Proportion of COVID patients getting to hospital is falling. Now, the reasoning is this: in the previous months, if you look at of course we know that there's this delay, so people get sick. Then probably sometime after that they're diagnosed. Then sometime after that they're hospitalised. And people tend to be hospitalised 7 to 10 days after they are diagnosed. Not the first day of the illness necessarily, it's when they get diagnosed. So what this study found in the States, if someone's diagnosed with COVID-19 on one day, then in 7 days' time, about 3.5% of those people are going to be hospitalised. That's been the figure in the United States in September and October, about 3.5 of those officially diagnosed. Now, of course, this isn't saying that 3.5% of people who get COVID-19 are hospitalised. Far from it. Far from it. Because we know that the vast majority of people in the United States are not officially diagnosed. There are many more people with COVID-19 undiagnosed in the States. We think about probably at the moment 6, 7, 8 times more than are actually diagnosed. So it's not saying the number that get it, it's the number that's officially diagnosed. And they are usually people that are symptomatic enough to want to go and take a test. So it is a kind of self-selecting sample, but that number has been around about 3.5% in September and October. Now, if you take it to 10 days, it probably goes up a bit to 3.7%. But this is 7-day data after diagnosis, and it's been 3.5%. And that works out about 1 in 29 people officially diagnosed with COVID-19 in September and October were hospitalised. So that's the way it was in late summer, early fall. Now, flash forward to the 15th of October. Let's take 15th of October as an example. So 15th of October, 53,000 people were diagnosed on the 15th of October. So 1 week later, multiplying by 3.5, you would expect there to be 1,844 admissions. There was actually 1,855 admissions. So basically you can see that figure, those figures are basically very similar, aren't they? So we can say that times 3.5% figure, 3.5% were hospitalised of those officially diagnosed. So it works out there, and if you look back, and it actually works out through most of September and October. That kind of calculation works out. 3.5% of those officially diagnosed end up being hospitalised. Now go forward to the 1st of November, and there was 80,000 people diagnosed. So that means on the 8th of November you would expect 2,800 to be hospitalised. The actual number was 2,604, down a bit, enough to be statistically significant, the difference between those two numbers. Probably not, would depend how you calculated the statistics. But so it's starting to look a little bit harder to get hospitalised with a COVID-19 diagnosis in the States. Go forward to the 15th of November. On the 15th of November, there was 146,000 new cases in the one day. Expected admissions 1 week later would therefore be 3.5% of that, which was 5,111. That's what you would expect. The actual number was quite a lot less, 3,670. So it looks like the bar to being hospitalised in the States is increasing. And of course there are anecdotal cases that I believe are true, but I mean I'm not saying they're representative, but people being sent home with oxygen saturations of 91%, for example, which is clearly not something we would normally do. I'm not saying that's the rule, that was probably the exception. So is it that people are getting less sick in the United States? Well, that's possible. Maybe diagnosed patients are less sick than they used to be. Another alternative, and this is probably a big part of the explanation, is the doctors and nurses admitting these patients are getting much more discerning, recognising with more acuity those who need hospitalizations and those who could be better managed at home. Because you don't want to go to hospital if you don't have to, because there's every bug you can imagine in hospital, and there's all sorts of risks of other complications in hospital. So we only hospitalised patients if they need some hospital interventions. So it could be they're getting much better at recognising who needs to be hospitalised. But it could also be that there is simply not enough hospital places, and sicker people are being sent home. So interesting observation, different explanations for what it could mean. But we do know that there's great staff shortages. So Kansas, for example, 46% of hospitals this week reported shortages in staff. Not so much shortages of physical space, but the staff to look after them seems to be the big issue here. So interesting trend, and we'll keep an eye on that and see if that carries on. Now, Mr. Joe Biden, President-elect, I believe, when he comes into office on the 20th of January, isn't it? 20th of January, is going to ask all Americans to wear a mask for 100 days. So classically in the States, the president's judged by his first 100 days in office. He's going to ask all citizens of the United States to wear a mask in all public places for his first 100 days. Excellent. Delighted to hear it. Clear message from the president-elect there. And I'm sure that'll be the first thing he does when he comes into office. Now, Anthony Fauci is going to be chief medical advisor on the pandemic in the new administration. And we have reason to believe he's accepted the post. We have a saying in England that you bite someone's hand off. I don't know if you say that in the States, but when they offer you a biscuit, you don't take the biscuit, you take the hand as well. So we believe Dr. Fauci's accepted that. So that is representing continuity, which is good, of course. Is going to now. Mr. Biden can order masks to be worn in federal buildings, of course. He can do that by order, and he can also apparently order masks to be worn on all public transport. So he will do so. It is within the power of the president to order this, apparently. So he's going to do that, but in all public places, American citizens will be asked to wear a mask. And it's good to see the leadership team leading by example on this. And I just really hope masks will be seen as critical, not political. Remember, mask wearing is critical, not political. It'll save tens of thousands of lives. Listen, what I've just said, tens of thousands of lives could be saved by that. And I really hope that people aren't going to make a political point about that, regardless of your views on politics. And I don't express a view on politics. I just say that is a significant step in the right direction. The president says that, of course, or the president-elect, my apologies to the current president, Mr. Trump. Significant reduction in coronavirus cases, according to the president-elect. Good, we agree. And Dr. Fauci agrees, and I agree, and Mr. Biden agrees, which is good. Now, Mr. Biden is happy to have a vaccine. Well, he didn't actually say this. They're my words. So if I've put words in your mouth, Mr. Biden, I do apologise. What the president actually says when Dr. Fauci says we have a vaccine, that is safe. That's the moment which I will stand up before the public. And we believe that President-elect Biden will be vaccinated before the cameras of the world when Dr. Fauci says it's good to go. Now, this is exactly the way it should be. Don't take vaccines or drugs because the bloke next door says so, or the woman at work says so, or because I say so, or anyone else on the internet says so, or anyone in the whole wide world says so, apart from your own doctor. So Mr. Biden is going to basically appoint Dr. Fauci as his medical advisor in this case, and will take the advisor when his appointed doctor says to take it. Absolutely correct. Don't take vaccines or drugs under any other circumstances. Having said that, in the UK we'll have a group prescription protocol, so it will be a standard thing. You won't need an individual prescription from your doctor, as indeed we do for flu vaccines and other things now. Now, moving on to the UK. UK vaccination. Pfizer, Tuesday NHS and social care staff to all of UK. Right, so all parts of the United Kingdom, it looks like, we were hoping for Monday, it looks like Tuesday. NHS and social care staff are going to kick off with a vaccination programme being vaccinated. Excellent. But remember, vaccine day 1, some immunity after a week, but we don't count that. Vaccine day 1, second dose of vaccine day 21, immunity 10 days later, immunity 31 days later, that we believe is 95% efficient. Doesn't mean stay still, don't need your precautions, and certainly for that month you absolutely need to take all all the precautions that you would normally do so, and indeed we would carry on even after the 31 days. But good news, it's starting Tuesday. I expected it to be a bit earlier, but there you go. Pfizer and BioNTech plan for the rollout of the vaccine have not changed. Now, there's been quite a bit of disinformation about this, saying that we wouldn't be getting the doses that we've ordered. Right, so we would supply up to 50 million doses of vaccines globally in 2020. That is still happening, according to the spokesman from Pfizer BioNTech. And it's in italics here because this is a statement from Pfizer BioNTech. So the rollout's not changed, the 50 million doses globally in 2020. We've delivered the first 800,000 doses to the UK, and we expect to deliver millions more this year. Any speculation regarding changes in this plan is incorrect. It's in italics, that's direct statements from Pfizer BioNTech. So picture there's been disinformation about that the vaccines weren't going to arrive and all this stuff. They are assuring us that they are. Just shows how much disinformation is going around. It really is a problem. Anyway, so that is going ahead. That's full reassurance on that from Pfizer BioNTech. Now, something I didn't know until today. MHRA, Medicines and Healthcare Products Regulatory Authority in the UK, have to give regulatory approval required to proceed with the splitting up of packs that have been put in place. So the MHRA, Medicines and Healthcare Products Regulatory Authority, it turns out they not only have to authorise the vaccine itself, but they're actually in charge of the distribution in terms of cold chain. Now, when these vaccines are sent off in these huge, like, boxes, they're like pizza box type things. I don't remember the number, but I think it's 900 and something, just under 1,000 doses, I think. And the MHRA actually stipulate how they are divided into smaller doses to maintain the integrity of the cold chain, which we know is so important in this vaccine. So they actually stipulate that. So I was quite reassured to hear that. So guidelines and regulations on that, and staff are being trained. So that's happening Tuesday. Good to hear. Now, we know that in these trials, the clinical trials, some people get the placebo, some get the vaccine. So when we start rolling out the vaccine, people that have been in the trial won't know, because it's the blind study, whether they've had the vaccine or whether they've had a placebo. So how do they know whether they get vaccinated or not? Because we don't want to put people at a disadvantage immunologically, or indeed have a risk of getting sick and dying because they have been noble enough to take part in the trials. So as a result of that, Oxford vaccine trial, volunteers are to be unblinded fairly soon. They're going to be told whether they had the vaccine or the placebo, because it would be unethical to carry on the trial after the vaccine is in use, is the argument. So that makes sense. So if people have been involved in the trials, they will be getting told. We don't quite know when they'll be getting told whether they had the vaccine or the placebo or not, but they will be getting told in time for them to make rational decisions about whether they need vaccinated or not, depending on when the vaccine will be available. So it is logical, and it is the ethical thing to do. Because remember, in the placebo group, 30 got ill and there was one death in the Moderna control group. So the people that have been noble enough to take part in that clinical trial, it's not an exaggeration to say that one person paid with their life, really. Although having said that, the vaccine simply wasn't available at that time. But the 30 did get ill and one died. And this seems to be the UK national position to unblind studies. The FDA will be advising on this soon in the States. But this is a problem for other vaccine trials. Now, there's many other vaccines being trialled at the moment in the UK. We think of the Johnson & Johnson one we looked at yesterday. And of course, there'll be second generation vaccines. So how do we look at the efficacy of these vaccines when other vaccines are available? And it would be unethical not to vaccinate 30 or 60,000 people while you do a clinical trial on them. Well, what they'll probably do, is when the efficacy of one vaccine is proven, they will use that vaccine as the control group and the new vaccine as the experimental group. So they'll be comparing the new vaccine with the old vaccine. That's the way this typically works. We do this with new drugs. So I was involved in the very first trial of these clot-busting drugs, these drugs that break up coronary thrombosis in the heart. And there we gave salty water or a drug called streptokinase. And it was clear that the streptokinase was breaking down the blood clots and the patients weren't dying anything like as much. So when a new substance came along, a new one came along called TPA, tissue plasminogen activator, that also broke down blood clots, you couldn't compare that against salty water because that would have been unethical not to give the patients the best available treatment. So the new trial compared the streptokinase, which we knew worked, with the new drug, the tissue plasminogen activator, and then we found out that the new one was a bit better. So after that, you kind of get incremental improvement. So that's probably what we'll see with the vaccine. So there are standard ways to do this. But the trouble is, it's going to affect the long-term effects. So what we mean here is, ideally, we would just leave the placebo group and the vaccine group for a couple of years and then see what the infections were like after 6 months, after a year, after 2 years, after 5 years. The long-term effects of the vaccine, comparing the infections in the vaccine group after 1 year versus the placebo group in 1 year to give us the longer-term effects. So we won't be able to do that, but I think that's just tough because it would be unethical to leave the control group unvaccinated. We'll just have to get as much data as we can once large numbers of people are vaccinated. So that's kind of what that was about. Now, England, police are to patrol perimeters of some tier and tier 3 areas to enforce non-essential travel rules. Now, of course, people have been travelling around. People aren't. Well, let's go on a minute. The government currently advises against non-essential travel from tier 3 areas or visiting areas in a higher tier than your own. And tier 1 Cornwall is to be protected by patrols of police in Cornwall. Because actually Cornwall is the only area in the UK with that is in tier 1 actually. Everywhere else is in tier 2 and tier 3. I'm in tier 2 at the moment. No, I think the Isle of Wight is in tier 1 as well. So Cornwall and the Isle of Wight are the only areas in tier 1, so they obviously don't want an influx of cases. Now, of course, if we compare the United Kingdom with Australia in terms of preventing people travelling around, in the UK, it's just been a joke. There has been travelling around. It's advised against, but it has been happening. Whereas in Australia, it didn't happen. Hence the fact that there's no community transmission at all in Australia. It was much more rigorously enforced in Australia. People did not travel between states in Australia at all, and that had a massive inhibiting effect on the spread of virus. Whereas in the UK, people have been travelling around, much less than normal. But it hasn't that been enforced. But now it's being enforced more, so that is encouraging. It's not for a long period of time. Now the trouble is, businesses on the borders are supposed to turn away custom. Now the problem here is that the reason that this is done on a county level is if it was done on a much more local level, and you had one village in one tier, and then the next village a couple of miles away in another tier, people would simply drive between villages. They'd shop around. That's why it's a bigger area. But there's still this problem at the borders. So people in businesses, pubs, restaurants, hotels or whatever, if people are coming from higher tier areas, they should be turned away. It's that simple. If that's always been done or not, I don't know, but that's what should be happening. Right, UK mass testing. Now, we've started this mass lateral flow testing in the United Kingdom. But the trouble is, it gives an awful lot of false negatives. So we're getting, this is the one that was piloted in Liverpool. And so someone goes along and gets tested and they test negative. And people have been testing negative even when they're positive. And even people with high viral loads have been testing negative. So you go along for the test, you test negative and you think, oh, that's fine, I'm all right, I'll just nip out and see my mates. You're not supposed to do that, but that is what's happening because of these false negatives. So I have question marks about this. There's so many false negatives. These tests really aren't accurate enough. I'm not sure these tests are accurate enough to be used, to be quite honest. So even those with a high viral load are still testing negative on some occasions. Now, counter argument there, Dr. Susan Hopkins, NHS Test and Trace, where have I gone? NHS Test and Trace. What we are doing here is case detection. We are not saying people do not have the disease if their test is negative. Right, so what she's saying is the glass is half full, not the glass is half empty. So she's saying that if people do test positive, they should then isolate for 14 days. Now, the degree to which people are doing that is unclear, but that's what's supposed to happen. But there again, people should be following universal precautions anyway. So for what this programme is costing, and with the great risk of false negatives, because if you get the false negative and you really would like to go for a beer at your mates, it's just kind of that bit of, it's kind of human nature, isn't it? I can kind of understand it, but it's not right. And to what degree is this happening, we don't know. So I just feel there's a bit of a mismatch between the ideals of test and trace here and what's actually happening on the ground. But if it's done properly, it's good, because you're detecting positive cases. How many false positives we get, I don't know, but you're detecting positive cases, and they're then self-isolating for 14 days. But then again, if people didn't want to take 14 days off work, they might not go for the test. So I'm just wondering if it's good, cost-effective use of income. I'll leave the question open. Now, good news. My local Aldi has started selling vitamin D. Now, why is that good news? I'm not advertising for Aldi here by any means. Other supermarkets are available, of course. But I have been I'm not going to mention loads of all the main supermarkets stock vitamin D. But the point is, Aldi didn't until recently. Aldi just stocks a fairly small range of items. But the fact that they've just started stocking vitamin D means there's a big demand for it. And that means that the message is getting through. So that's good news, because 50% of the time I go shopping, the big supermarkets are sold out of vitamin D. You have to go in the morning to get it. So that really means that the vitamin D message is getting through. And when we consider how dark, it was early evening now, it's pitch black outside. So it's good news, I think, that this message is now getting through. More people are taking vitamin D. And just try it. Talk to your mates and say, look, you've heard about the importance of vitamin D, and many people are taking it. And just out of interest, I've worked this out. So there's 105 tablets of vitamin D there, 12.5 micrograms. That worked, and this was £2.49. Again, I'm not advertising, it just shows that these things are relatively inexpensive. So that's 1,312 micrograms of vitamin D in there for £2.49. And at the moment I'm taking 50 micrograms a day, so I would take 4 of those a day if that was me. I'm not telling you what to take. So that's what I'm taking. So good news because it's fairly inexpensive, and good news because it shows the demand is there, and vitamin D seems to be getting sold out. So that's good. Just a few other countries then we finish. I've gone on a bit today, I know that. Briefly, Bahrain gives the green light to the vaccine, emergency use authorisation for the Pfizer-BioNTech. So the UK was the first country to authorise this, and Bahrain is now the second, part of the United Arab Emirates there, of course, in the island in the Gulf. I think Bahrain's an island, I'm pretty sure it is. Okay, so good. No news on what they've bought or when it will happen, but in principle they've agreed that, and that is only the second country. Now, Russia, meanwhile, is starting mass rollout tomorrow. Now, the cases in Russia, as in everywhere, are more than the official numbers. We know the official numbers in the United States, for example, are about 13 million, but the actual number is about 100 million infections. So that's the number of officially diagnosed cases in Russia, up 28,782 in the past 24 hours. Quite a big increase. Moscow is a bit of an epicenter, a lot of cases in Moscow. Nearly 8,000 cases in 24 hours. Deaths in Russia increased by 504, up to 42,000 on official figures. Now the Sputnik vaccine, Sputnik V, it's going to be rolled out in 70 clinics tomorrow. In fact, by the time you're watching this video, probably today, because it's Friday evening now. So, in fact, is it Saturday? No, Saturday today. What am I talking about? A bit disorientated for time and place. So the Sputnik vaccine is being rolled out as we speak. Saturday, being rolled out as we speak. Medical workers, teachers and social workers have applied online to be first. Now, interestingly, the age is capped at 60, so people over 60 are not getting the vaccine. People with quite a few underlying health conditions, pregnant women, people with respiratory illness in the last 2 weeks are not getting the vaccine at the moment. Quite why that is, I don't know. Serbia, is that Serbia or Siberia? Anyway, never mind. Siberia, sorry. I'll just get them mixed up. So Siberia's Vector Institute vaccine is another vaccine. It's another vaccine that's being developed in Russia as well. But the one that's being rolled out is the Sputnik V. So the process has now started in Russia. The problem in Russia is that they have limited manufacturing capacity. So quite how far that will go, how many doses, we don't know, but 70 clinics giving it out as we speak. Now, Africa, very briefly, Democratic Republic of Congo. Reports in the popular media, hospitals have seen an influx of COVID-19 patients and more severely ill COVID-19 patients. So hospitals in the Democratic Republic of Congo are reporting more severely ill patients, and they don't have the oxygen. Part of the problem is in Kinshasa, they keep having power cuts, so the oxygen producing plants can't make the oxygen because of the power cuts, because of the poor electricity supply. And I think this guy was the health minister, I can't quite remember, but he says the number of cases is rising and cases are more serious. And the testing is also remarkably low. So even though there seems to be many less cases in Africa, there has been recent indications in some African countries that that's changing, and there are somewhat more cases now and more severe cases. And people that would readily survive in Western countries, in the Democratic Republic of Congo, they could well be dying through simple lack of oxygen, which of course is quite tragic, really. Totally tragic. Dying for lack of simple clinical interventions. Germany, they've had all sorts of protests, big protests in, I think it was Berlin, there was protests. Anyway, Bremen in the north, that planned a protest for 20,000, has been banned by the judges. And the Robert Koch Institute is saying that because Germany was so successful in the first wave, people don't realise how significant a risk this virus is. Buy that one if you want, I don't. I must say, I've been taken aback time and time again by Germany. It's not the disciplined country I remember from earlier life. Right, anyway, the judges have taken charge there and it's banned. Now, just a couple of pictures to finish. Oh, yeah, Sarah sent this one in from Cornwall. This is a series of videos I did on the respiratory system. I think she's been showing it to her children during lockdown. So you can't see it very clearly on the telly, but that's the trachea. That would be the larynx, that would be the vocal cords, that would be the cricoid cartilage. That one there is the incomplete rings of cartilage in the trachea, and that is the esophagus. If you want the full details, do go and watch the whole video. Oh, now I've been causing trouble. Let me just show you this one. This is me causing trouble. Now I've actually made the local paper in Carlisle, so I'm described as a Carlisle health expert. Believe that one if you like. Festive fears, talking about and this is a genuine concern actually, given the Thanksgiving problems we had in the United States, and Christmas is coming up. We could have similar issues here, unfortunately, resulting in potentially a big spike in January. I do hope I'm wrong. And finally, this is from Helen in Ontario. Look at a few pictures. You might remember I asked people to send in pictures from around the world that illustrate your personal experience of the pandemic. What's it like for you in your daily life is kind of what this picture theme is supposed to be about. Anyway, this is Helen in Ontario. I guess this is the library. Social distancing, plastic barriers, mask wearing, limited amounts of people. Now we can't see it, but I do hope those windows are open. Empty seats on public transport. Good for social distancing. Outdoor dining, and it looks like it's still nice and sunny there. That must be a week or two ago though. Probably getting a bit parky there now for that. It's a bit cold in Ontario, I believe. Now this is a good one. Keep out of melee range. Perhaps good advice at the best of times, but we don't want any fights. So keep out of melee range. Nice gap so that there's no differences of opinion. Well, that was quite a good one. Please wear a mask. This is the way. Good. Nose and mouth. Public mask if required. Please take one if required, and that's the public library, so that's good to see. Now, I've been getting a bit annoyed lately on the. I don't watch TV, which is such a load of blinking dribble. I hardly ever watch it these days. But the BBC, for example, they have people on, and they're like, okay, they're probably 2 meters apart, maybe a little bit under. But there's no evidence of drafts blowing through the studio. So they think that because there's a gap, they're all right. They seem to forget that the virus can spread by aerosolization. So the mask wearing, of course, is important. The hand hygiene is important. All of these things, massively important. But if you're socially distanced for a period of more than 15 minutes in a nice warm television studio, your chances of spreading the virus, if there's one person infected, are somewhat significant, unless you are maintaining good ventilation, and I'm not convinced they are. So it just annoys me that they're doing things that appear to be the right thing, but in actual fact they seem to be not ventilating the studios. If I'm wrong, do let me know. But the advice, even though it's cold, remains good ventilation. Social distancing without good ventilation over a period of time will still result in viral spread. Okay, thank you for watching as always.